Introduced in 2001, the 9-item Patient Health Questionnaire, PHQ-9, is a diagnostic instrument used to evaluate adult patients in primary care settings for depression symptoms. The tool evaluates for the possibility of a depressive disorder, as well as the existence and intensity of depressive symptoms. Although it can be used alone, the PHQ-9 is a part of the wider self-administered Patient Health Questionnaire, PHQ. Completing the PHQ-9 takes less than 3 minutes. It is scored by simply totaling the scores of the individual items. Every one of the 9 items corresponds to a DSM-5 depression symptom. The PHQ-9 can be used by primary care physicians to assess patients for potential depression. A patient may be asked to complete the PHQ-9 on paper, or may be given the survey questions in the form of an interview. The PHQ-9 questions mirror the DSM-5's Major Depressive Disorder, MDD, diagnostic criteria. The questions focus on what the patient has been up to throughout the past 2 weeks. Anhedonia, feeling down or depressed, sleep problems, sleeping too much or having trouble falling asleep, low energy or fatigue, eating problems, poor appetite or eating too much, self-worth, feeling like a failure, ability to concentrate, psychomotor problems, speaking, moving slowly or fidgety restless, and suicidal thoughts are among the questions. The spectrum of responses is 0 inches, not at all, to 3 inches, almost daily. The 11th question concerns the degree to which the symptoms listed above make day-to-day functioning challenging. Clinicians may utilize the answer to the 10th question to help determine the patient's degree of impairment, even if it is not included in the final score. Depression levels are roughly indexed by the sum of the replies. The possible scores are 0 to 27. A sum of 10 or more generally indicates the possibility of depression. The pattern of responses to PHQ-9 items can be used to make a tentative diagnosis of MDD. 5 or more of the 9 criterion symptoms must be present for most of the day, nearly every day, for the preceding 2 weeks, in order for the DSM-5 to classify a person as having MDD. However, one of the symptoms must be either anhedonia or low mood, as indicated by questions 1 and 2 on the PHQ-9. The PHQ-9 can only provide a tentative diagnosis. It is not suitable for genuine diagnosis. That can only be done by a qualified clinician. A qualified clinician, for instance, can assess if substance abuse or another medical or mental illness more accurately explains the symptoms.